Are you ready? On the Ledge VIP podcast. Let's get to it. All right, thank you for joining us today. This is Carl Calendar once again on the Ledge VIP. I have the great pleasure of having Dr. Elmore Alexander in the house. How you doing, Doc?
I am doing great. Thanks for having me, Carl. It's a pleasure being on your show.
Well, we're going to dive in real deep today because we're going to be talking about health for the females and the males. But first, I just want you to tell our listeners a little bit about yourself.
Well, Carl, I got into this whole thing of female and male wellness probably about 5 years ago, where I started to really specialize in it. And I've been doing it for about 30 years because I started out as a naturopath, or in that direction, I should say. Went into a holistic realm of medicine, which is called osteopathy. Okay, there's two licensed physicians in the United States. One is allopathy, and the other is osteopathy. The allopaths are called MDs, and the osteopaths are called DOs. Now, not everybody knows that we exist because a lot of us practice the same, but we have more of a holistic approach to medicine.
Got it.
Now, I'm fortunate because in the state of Georgia, I'm considered an MD as well because I did an MD residency. So I went the osteopathic route where I learned the whole idea behind the structure and function of the body, and then I also went into the MD realm. And now I'm utilizing that to take care of adults. Those adult problems as we start to get older, as we progress in this life, certain things begin to happen. And some of these things we don't like to talk about.
Like what?
Like our personal health, okay? So I'm being very gentle right now, but we're gonna get real, okay?
Well, please get real.
Yeah, this it's actually the sexual health.
Okay.
But when I use the word sex in any way, even though we all need it, it is a biological need to have it, that when I use that term, people start to shy away because somewhere in there we've been taught, especially I think people that are probably over 40 years of age, that there is something wrong or taboo about speaking about sex. We're not talking about pornography. We're talking about relationships. We're talking about a way to communicate with each other. All right. So let's be real. Let's just back up a little bit.
Because we lost that contact.
Yeah, we lost that. So let's just be real. All right. When you get married to someone, okay, is your first instinct that what you want is a roommate?
No.
No. Is it your first instinct that I want to get married to share bills with someone?
No.
All right. Somewhere in there, intimacy is a part of it. Okay. And you want to stay within certain morals or guidelines that you've learned in order to be able to have those intimate moments.
Yeah.
So intimacy is very, very important to all of us, and being able to stay functional during the entirety of the relationship.
Right.
And when I say the entirety of the relationship, for the next 40, 50 years, 60 years that you're married, the intimacy plays a big part.
Right. That's that connection.
That's that connection. But unfortunately, our diets and those kinds of things, stress, the way that we live, sometimes affects the organs so that the organs don't respond properly, and people lose their ability to either function, to either have, like in the case of a man, it's very evident. He can either get an erection or he can't.
Right.
Okay. It will either stay there or it won't, or he's premature. Any of those things cause frustration in the man as well as the woman because they're not able to keep the connection long enough so that they can get the kind of bonding and satisfaction that they want out of this.
Let me ask a question.
Yes.
So when that happens to a man, sometimes he can they're having that connection.
Yes.
And all of a sudden he just gets limp.
Right.
Would that be considered something going on with him? Or is it some type of other connection that we're talking about?
Well, I mean, we can talk about the psychological part, but I think we put too much emphasis on that. And before we start talking about the psychological part, which is what medicine has done to us, and it's unfortunate because they really have exploited that when it comes to women. And I'm going to get back to your question. I'm not going to get too far away from this. But this thought comes to me because it hurts my heart that I was one of those people who discounted the real physical changes that a woman goes through as certain things happen in her life. She has babies, she has stress, she has job, lack of sleep, maybe her thyroid's off, whatever. And all of a sudden she loses that urge. They will tell her that is psychological. And that's what we've been telling people. Oh. You know, we might have to put them on an antidepressant, or it's just in your head. The reason that, we use very derogatory terms like being frigid. Okay. So in a small amount of people, yes, if you've been repressed by someone, they're abusing you, no woman wants to lay down and feel good laying with a man who is physically and emotionally abusive. That is a psychological issue. But a lot of women have an urge. They do want to connect, just like a man wants to connect with his partner, but physically something is going on. And those are the areas I like to spend my time in. Now, if after I do what I do, because I know that most of those cases, that's what's going on. So after I do what I do, if we're still having an issue, or if it comes up that there is something in someone's past, maybe they've been abused, or there is something going on where there's maybe some trust issues, then they may have a psychological reason. As a man, when I was young, if things didn't quite have the right odor that they were supposed to have, I would go limp.
Right. Of course.
So that's a whole different thing. But what we're talking about is, you want to be there, and all of a sudden, you don't have the longevity that you normally have. Okay. This is called erectile dysfunction. Okay. So any part of the process that doesn't allow you to be able to get an erection that allows you to have meaningful intercourse, that is called erectile dysfunction. Okay. So any part of it. Okay. Even, some guys have prematurity. That would be erectile dysfunction. Here's the great thing. We have a fix for that. Okay. We have a fix for it. So had, this is where it really got interesting for me. Okay. Go ahead. There was a gentleman who some years ago had some issues with sleep. He was starting to not think as quickly as he had before. And he was having some erectile problems, okay? His erections weren't as dependable as they used to be. Okay. All right. He also noticed that when he worked out, his recovery was not as good. Okay. So he would go out, he started cycling, he would go out with these young guys. This guy was in his 50s. He would go out with these young guys, and he got to a point where he could physically get in enough shape that he could stay up with these guys. But after the ride was over, he would have to sit in his car and wait for a while for his body to recover. And then he couldn't go back out for another 2 days because his body was recovering from that activity. Okay. This went on for years, and he's trying to figure out what's going on. Like, I'm working out, but I'm not getting any better. I'm working out, I'm not getting any more in muscle tone. I'm working out, and it seems like my cardiovascular system is just not getting any stronger. And my recovery should be getting better, because when I was a young man, I would get that second wind, And erections aren't getting any better. So what's going on? You know what's happening?
What's going on?
He needed his testosterone checked.
A lot of men don't know that, because the first thing they think of is, I need more supplements.
Right. And this guy, actually, that's awesome. He was actually taking the vitamins. He was taking what they call these nitric oxide boosters. He was taking all kinds of things, trying to get out there and go with these guys. He was taking Capsaicin tablets, and he went, and this guy actually was a physician. Okay. So he's taking care of people, and for years giving guys testosterone, writing prescriptions for them, and never thought to get his check. Okay. Wow. So he goes to the doctor, gets his check. The cutoff that they tell physicians is 300. Okay. And the range goes all the way up to 1100. So in the blood, testosterone should be anywhere from 300 to 1100. This guy was in around 250s. He was in the 250s.
Okay. He was below.
He was below the 300.
Correct.
Okay.
Yeah.
And here's what a real trip is. There's going to be a lot of guys that will notice that even if they're running 450, and I have one patient right now, he's running 525, he's still feeling fatigued. Okay. Now the range goes to 1100, right?
To 1100. Okay.
Right.
I got it.
Right. We're taking him to around 750 now, and he's starting to get the positive results that he was looking for in the bedroom, as well as, he said, his thinking. He was a professional football player, so he probably always ran around 750, 800.
Right.
Okay, and now he's down 500. He's low for him, but his doctor would tell him that because the range is, they don't want to treat him. But he comes to me, and I made sure that he gets up to 750, and this gentleman is doing better. Now, the first guy that we're talking about was me.
Okay.
Yeah, that was me.
That was you.
That was me. Okay. Got my testosterone up to about 450, and I was feeling better. I was recovering. Up to 600, I'm riding with the young guys.
Right.
And they can't stay with me now. And this is not Lance Armstrong kind of dosages of testosterone. We're talking about normal physiologic doses. This is what your body needs.
Right.
Okay.
So it's more natural.
Right. This is not what, like, bodybuilders.
Okay.
Bodybuilders are they're trying to get their testosterone up 3,000, 4,000, 2,500. Okay, that's what they're running. Okay, in order to get all these muscles and things, and they're taking some other things as well to get big.
Okay.
No, we're talking about what the body needs on a normal basis.
Okay.
Now, having said that, do you know women have the same issue?
I did not know that.
Same issues. They'll tell you, I'm having problems with sleep. You're always asking your wife when she gets to be 50, why you keep putting your stuff over there and you forget to put it over there, or you're putting things away over here and it should be over there. Why do you keep forgetting? Are you just, you start getting into these discussions about whether or not they're just disrespecting you or they just don't care.
Right.
Okay.
Yeah.
And it's not that. What it is that women are supposed to have testosterone too. The reason that they are so afraid of it is because they don't know what the number should be. Doctors don't even know what the number should be. A woman only needs to be, in order for her to be physiologic, now remember I said men is between 300 and 1,100.
1,100.
But it's really 600 is where they should be.
Okay.
Any man comes in less than 600, I'm treating him.
Okay.
Because I know that he's low. His tank is low.
Okay.
I'm going to get him up to around 600 and keep him there. Okay. If he's he was a football player or something like that and he's still having some issues, I'm going to take him up 750, 800. You know what women need to be?
Where?
15 to 70.
That's it?
That's it. That's their range. Their average range is somewhere around 45. So we're not even talking in the same ball game.
Right.
And it changes their life. They'll start to get muscle tone when they go and do Zumba, where they work out in the gym. Mm-hmm. They'll start to remember again where they put their keys. They'll sleep better. She'll be grabbing you in the middle of the night saying, hey, you know what? I'm feeling some type of way.
Well, Doc, this is something that, like you say, no one's talking about, or they're not willing to talk about that, or they have the lack of knowledge.
Yes.
To share this information.
Yes. They have fear because there have been so many there's fear because they've had so many negative campaigns against testosterone. Mm-hmm. There's been, they keep showing the bodybuilder who died of a heart attack, or these people that look abnormal because they have all this huge amount of muscle. They talk about the athletes that cheat in order to win. This is not cheating. Okay? This is a hormone. Now, what do I mean by that? I think everybody in the United States knows somebody who has a thyroid problem.
I used to have one.
Okay. What do they give you?
Oh, man, I forgot the name of this pill.
But it's thyroid hormone.
Correct.
Synthroid, whatever.
Right.
It's thyroid hormone.
Okay.
What I say?
Yeah.
Hormone. Vitamin D. Okay? People have no problem. If I tell you your vitamin D is low, you have no problem taking a vitamin D supplement. It's over the counter.
Right.
Do you know vitamin D is the only vitamin that's also a hormone?
Did not know that.
It's a hormone. Okay, we don't have a problem taking vitamin D. We don't have women when they get older. Some of them need estrogen, right? Mm-hmm. It's a hormone. How many women do you know take birth control pills?
I don't know many now at this age, but I used to know a lot.
Right, but we do know that there's a lot of women that are on birth control pills. Okay, and we take that as a norm that people take birth control pills. They are a combination of hormones. Okay. So if this is everyday utilization of hormones in order for the body to respond a certain way, why are we afraid of another hormone that we all have that needs to be replaced so that we can sleep better, think better, exercise better, recover better, and even have a good libido, strong libido, so that we can connect better?
Lack of knowledge.
Testosterone is needed.
Yeah.
It's needed. Now, when it comes to men, because of the level of testosterone that we use, then we also need to add in a couple of more hormones. One is HCG, and then another one is not a hormone, but it's called anastrozole. We take those medications as well, one, to maintain the testicular size of men, because once you take in a little bit of testosterone, your body will have a tendency to want to shut down its own production. So even though my level was in the 250s, my testicles were still producing some testosterone. Well, I don't want to stop producing what I have.
Right.
So we take some medications, and we, because we understand the physiology of it, so we're, it's getting sophisticated. But we take some things to make sure that we keep producing our own. And then when you produce a certain amount, sometimes it wants to go down another pathway where you'll start to get some estrogen. Well, I don't want to get too much estrogen as a male.
Right.
Okay.
No, I don't want that.
I don't want my voice to get high.
Yeah.
Right.
I don't want that.
Right. So we want to balance that, because the key is I still need estrogen. You need estrogen. Okay. So estrogen is a hormone. Men have estrogen just like women have testosterone.
Correct.
Okay. But it's the ratio. We want to keep that ratio of testosterone to estrogen within a certain range so that we function maximally.
Okay.
So that's what's important. So these other medications help us to keep all those things in line. The testicles doing what they're supposed to do. We don't get too much estrogen. We're producing what we want. And it also gives us an extra boost of energy as well. Okay. So all these things kind of go in to keeping us what? Normal. This you're not going to go out and run a 100-yard dash and beat everybody, okay?
Right.
No, these are normal. This is what you need in order to function every day to be at your best.
Okay.
And as you're exercising your body to get better and better, it allows you to be able to make your goals.
Okay.
That's it. It's not going to make you superhuman. It's not going to take you beyond your potential like you do when you're taking these huge, beyond physiologic dosages.
Okay.
Right.
So once you do what you do,
yes,
to help out the male or the female, how long does that process usually, as far as after, how long does it take? Does it go on for a long period of time, or it all depends on the individual? Would they have to come back?
Oh, okay. Well, the onset of the effect is probably, at least the way I do it, you're going to notice something within 10 days.
Okay.
You will notice a difference. Okay. We use a little different approach than a lot of people. Okay. And I like to use what we call injectables, and people are scared of injections, and I was too. But I figured out a way, and I don't know, a lot of people don't know about Botox, but a lot of people do know about Botox. Botox needles are very, very, very thin. They're the same one that diabetics use to give their diabetic medications. Okay. It's so small that most times you don't even feel it go into the skin at all. All right.
Okay.
Now, I figured out a way how to get the medicine into the syringe and then get it through this small needle so that you can take it. So that's what I do in my office.
Okay.
So it's easy. It's non-intimidating. When you do it the first time, you're going to go, I can do this for myself. Now, these bigger needles that we use, they're scary. I can't give myself one. Okay. So if I can't give myself one, I'm not going to give it to you.
Right.
Okay.
Thank you.
The first time I tried to give myself a shot some years ago, Sweat just came all off my head. I missed. The medicine went down my leg. I hurt myself.
Bruised your leg.
Right. It was a catastrophe. And now I'm able to use this small needle. It's non-intimidating. You give yourself a very small amount several times a week. And it is so smooth.
Okay,
so
you
smooth.
would do that, right? Not for an individual trial on their own.
No, I give it to them themselves. They'll take the medication. They'll do it at home. I'll teach you how to do it.
Oh,
you'll be able to do
okay.
it. No problem. No problem. I haven't had anybody yet, even my father, who is definitely scared of needles. He was able to give himself this injection once I showed him how to do it. Yeah.
Wow, I'm up here trying to think if I could do it.
It's because it says injection,
right?
It's very intimidating, but when I show you what this thing is, it's unbelievable. It's so small, it is so tiny.
Okay,
and we're able to do this and put it. You don't even have to put it into the deep muscle. Okay. This is something we thought we needed to do, but now this is where the bodybuilders have actually helped us with some of this stuff because they've been doing this thing for 50, 60 years.
Right.
They have learned some things about it, and then our research now is catching up to what these people were doing kind of illegally. All right, and now we know that there's different ways that we can give these medications, be very effective, and help people to get their lives back, help relationships return. I was talking to a woman yesterday, and she said that her best friend, her husband and her, and this woman is in her 40s, they've been sleeping in separate bedrooms for 7 years, okay, because he's not functioning, and he's not trying to do anything about it, okay?
So it caused them to not sleep in the same bed? I mean...
They are sleeping in separate... there's so much tension between them that they're sleeping in separate bedrooms. She said, we're basically roommates. Here's the bad part, okay? While he thinks everything else is normal in their relationship, her desire for comfort has not gone anywhere.
Okay, yeah.
And she has gone and gotten it in other places.
That's not good.
But this is the reality of someone who doesn't realize that your wife didn't marry you to be your roommate.
Wow.
Okay?
Wow.
Now, it's one thing if you have a disease, then you're committed to that person. It's another if you're shirking your responsibility and there's answers. Okay? There's answers to these problems.
Right.
You get me?
I understand.
So, when you start talking about divorcing somebody or someone cheating, okay, to me, you're cheating that other individual when that was a part of the contract.
Correct.
You've broken the contract.
Right.
Now, I'm not condoning any type of infidelity or anything, but I understand.
But yeah, gotta understand that.
I understand.
About it, for 7 years, something's going on that's outside the relationship. So
she's a young, healthy woman.
Right.
She's young, healthy, vibrant, and let's understand something. In Japan, they have an aging elderly population. They had population for control for a lot of years, and they could only have 1 or 2 children. And the second child had to be approved by the state. So now you have all of these older people who had 1 child, and many of these children are having a hard time making it on their own. So the elderly are winding up in these institutions where they're being housed and corralled. The depression is going up astronomically. And what they found was that a big portion of that depression was that these people weren't being touched. We're not talking about sexual intercourse.
Right.
We're talking about just touch itself. So they brought in some animals to see if that would make a difference. And those people who were given animals to comfort them, the depression got better and they became more productive. But they found out there wasn't enough animals in Japan. They didn't have enough animals because they did population control on the animals too.
Okay,
right.
All right.
So somebody was smart enough to build a robot. The robot only said a couple of words, and it was very furry. I think it was made out of lamb's wool.
Okay.
And this thing would come in, and they did it by a remote control. And these older people, these were people in 70s, 80s, 90s, that were bound to these institutions because they couldn't work on their own anymore. They couldn't live on their own. They would hug this thing, and they would literally talk to it and have a conversation. That's how much they needed tactile stimulation, that stimulation of a hand, someone,
some type of
touch, right. The Bible says that you need to not only, well, it says, it talks about having relations within the confines of a marriage and that kind of thing. But it also says, once you become married, that it's your responsibility to not only to have sexual intercourse, okay, which they say, they term that as becoming one.
Right.
But it said, do it often. It said, do it often so that you don't get a lot of confusion from the outside.
Okay.
This process keeps you bonding together. It keeps you communicating.
Oh, yeah.
It keeps you talking. And when you have good orgasms together, you talk on a different level.
Oh, yeah.
You really do.
You hear the birds chirping and, you running through the prairie. Everything is lovely.
That's right. When she gets up in the morning, she say, baby, you want some breakfast? If she cooks. Right.
If she cooks, yeah, I do.
Right. If, when she's brushing her teeth, you look over the sink and you in the bed checking her out, she give you a little toot, and she goes, yeah, this is yours.
Yeah.
And you look over and go, wow, that's my lady.
Yeah.
And you want to, you listen to her. That's the one time you sit, and you listen to what her day was like, what she's feeling. And you see how she's changed from 12 hours, 24 hours, 2 days ago.
Right.
You see what she's learned differently because she wants to talk to you about it. And she has your full attention. And vice versa. You have her full attention and you're able to tell her more about how you've changed and and it's those changes, those little changes that we can accept. It's when we haven't been connecting for a month or two that all of a sudden you come up with something new and you go, I don't know who you are.
Yeah. Or I don't know if I still like you.
Right. Those are important things we need to be looking at. But when you keep connecting, that energy that you exchange, it helps you to really understand who is, and it helps you to keep reconnecting with each other. So we do want to make sure that we have our hormones checked, that we are doing things that keep ourselves physically fit so that we can keep our mind sharp and our body sharp. Having said that, we've started a men's program as well. It's called Smart Men's Center.
Okay, tell me more.
And I partnered with a pharmacy that is a U.S. pharmacy. So this is not coming from China and these other places. It's a U.S. pharmacy. They're using U.S. manufacturers, and they have generics of Viagra and Cialis. We have 20 milligram tablets of Viagra for $1.
Repeat that again, please, sir.
20 milligram tablets of Viagra for $1. We also have 100 milligram tablets of Viagra for $3. And we have Cialis, okay, the generics. These are all generics of these, for $3. The name brand of these products are $45 per tablet. Most insurances, if they give them to you, will only give you 6 tablets.
Right. Okay.
You can get a month's supply from us, okay, with a refill. Okay, for just a small office visit. So if you go to smartmencenter.com, Smart Men's Center, SMART, mencenter.com, you can get with this program with us. You do have to have a prescription, so there's a small office visit, okay? And you can get your medication without seeing a doctor, okay? You do have to tell me a little bit about the fact that you have erectile dysfunction and what's going on with you. I do have to check and make sure that you don't have certain conditions that would not allow you to be able to get the medication. So if you're on some kind of medication like a nitrite, like nitroglycerin or something like that for a heart attack, and they're trying to prevent you from having a heart attack, then you would not qualify. But other than that, there's some things that I would be looking for to make sure that this is safe or to give you good information about it. And you can get the medication without coming into the office.
Okay.
So if there is a level of embarrassment, if you don't want to come and have a face-to-face, we can talk about this. Okay. And you're talking to a man about it. Now, a female may contact you just to verify that your information is correct. Okay, that may happen. Right now we have a man doing it. That could happen. But when you sit down and talk about your problem, you're talking to me.
Okay. Directly to you.
Directly to me.
That makes a difference.
Okay. I'm going to call you myself. You're going to have a conversation with me. So even though this is by phone, it is an office visit. It won't take a lot of your time. Okay. But we do need to know a few things. You know, I do, as a physician, I need to make sure that you are going to be safe. The other thing I want you guys to think about is that this is exercise. So if you have not been having sex, you have not been exercising in a long time, be careful. You know, sexual intercourse is a physical activity.
It is.
And if you go at it hard in the beginning and you haven't gotten yourself in shape, you can have a heart attack. Just like going out and trying to play basketball on the court and you haven't been out there in 10 years, you can drop dead, you know. So realize that this is a physical activity. It's real. And that's one of the things that we tell people, too, that, yes, it is a form of exercise. Mm-hmm. But what I would tell you, if you want to be really good at it, get in shape to do your sport.
Right.
Don't do your sport to get in shape.
Right. Or can they just start off just laying down for the first couple of times?
I mean, you can
not really do too much.
Pace yourself.
Okay.
Pace yourself. See how you feel.
Right.
You know, your partner can get involved too. And having said that, now this is interesting. We are finding out that, you know, what Viagra does is it opens up the blood channels. Okay, and a lot of gentlemen that have erectile dysfunction, I would say probably 85%, they don't have a neurological problem or even a psychological problem. What they have is they have blockage. Okay. So this is a blood vessel. The penis is a blood vessel. All right. It's a system of vessels, and it fills up, and there's some spongy tissue in there that fills up with all this blood that comes in, and it swells and it elongates, and it gets nice and firm. Okay.
Right. Okay.
Now you're able to have intercourse. Understand something, ladies. Same thing happened to the labia and the clitoral apparatus. When you get excited, what happens, especially when you were 19, all right? You got moisture, right? You know, the guys always say, you know, I'm trying to get your panties wet. Well, it's real. That's because that's that moisture, right? That's that moisture. Okay, so that's supposed to flow. Well, there's also a moisture that comes out of the male. It comes out the tip. You know, we used to call that pre-cum, all right? It's that little water. What that's supposed to do, it has a function, okay? It goes into the vagina, and it neutralizes the acidity of the vagina so that the sperm can live longer.
Wow.
Right. It neutralizes that acid state.
Right.
Okay.
Okay.
So we all get a little lubrication.
Right.
So I'm trying to get something here. I'm trying to get you to understand something. The organs may look a little different, but they function exactly the same. What happens to the labia in the women? It swells. Right? The clitoris starts to swell a little bit. So that hood will go back. That hood will come off of it, right? And it peeks out at you.
Right.
All right. That allows it to be stimulated easier.
Right.
Okay.
Okay.
And the tissue swells so that it can accept you better. All right. Now, what if those vessels are starting to get blocked up? And what would cause those vessels to get blocked up? The same thing that causes cardiovascular disease.
What is that?
Plaque. Right? So we know people have strokes. We know people have heart attacks.
Right.
The first signs that somebody might be headed towards a heart attack or stroke is when the labia don't swell anymore. I'm excited to see you, but my labia don't swell.
Okay.
I want to have sex with you, but my labia don't swell. You look good to me. You're my kind of man, but my labia don't swell. You turn me on, but the labia don't swell. Blockage of blood flow to that area.
Okay.
So if it's blocked there, guess what? It's blocked other places. Same thing with a man. Wow, there's the lady of my dreams. That's my woman right there. You know, I'm at the bar and I see her and she's so fine and her voice is just resonating with me and I can't get an erection.
That's
Blood flow problem.
That's a problem.
Blood flow problem. All right. That artery is blocked up. Blood can't get in it. And the valve, once it gets in it sometimes, the valve can't stay closed because it's got deposits around it that won't let it clamp down enough so that the blood stays in there long enough for you to be able to have a meaningful erection. Okay.
Well, I know you got a solution.
Well, Viagra is the first thing we do.
Okay.
Women can even use it.
women.
Right.
Take Viagra.
They can take Viagra. We give them a little lesser dosage usually, but they can take Viagra to help with the swelling of that labia. And women are reporting that they feel a little more excited, okay?
Okay.
That there's a little more stimulation down there, but they feel a little tighter too.
So when we look at these commercials that come on, Cialis and Viagra, there's always focus on the men. Why haven't they ever focused on the ladies?
Oh, that is so profound that you would say that. Women have been totally neglected in this whole system. There are over 20-something medications and processes that we have for men to get them erect. Okay? Mm-hmm. There is not one FDA-approved testosterone preparation for women. There's only one medication that is approved, and it is so dangerous we won't give it. It is so dangerous that we don't even give it. Women have been totally neglected because up until this point, we said it was all in their head.
Right.
And I have to admit, right here and now, ladies, that when I started learning the procedures to help men, I went in totally to help men. And when I got to the course, the women far outnumbered the men because they were there to learn the procedures for the women. And when I got there, I learned more about the female organ and what I should be looking at and how important it was. I kept thinking that as long as the man could get hard and we had lube, everything was fine. And the women started telling me, you know, you're just pushing against two walls that won't move. Yeah, you got in, but there's no satisfaction. Mm-hmm. And I had women telling me, yeah, a lot of that moaning that these guys hear is not because I'm moaning with pleasure. I'm moaning because I want them to stop, and I'm moaning because it doesn't feel good and because it hurts. But I don't want to hurt his feelings, and I'm letting him think he's doing something. But the reason I'm not chasing him is because it takes me 10 days to get my head right again, to have sex with him again, because I know I don't want him in the street. So I'm trying to give him a little something. Ridiculous.
That's wow.
It's a tragedy.
Wow.
It's a tragedy that physicians are so disconnected. Women are coming to me saying, my OB doctor won't give me testosterone. My OB doctor won't talk about the sexual aspect.
Do they need to be taught, or are they just what's going on that? I mean,
you know what? I haven't sat down with the physicians. At this point, all I can do is tell people, you know what? I have an answer for you.
Okay.
So besides these things, we have other treatments that we can do too. We can open up the blood flow. Right. We can open up the blood flow. We have a procedure called an O shot and a P shot. The O shot's for women, the P shot's for men. And what it is using the growth factors in your own blood to heal your own organ. I can take those growth factors out of your blood by spinning your blood down, separating them out, and I can take those growth factors and put them back in to the sexual organs without any discomfort at all.
Okay.
And rejuvenate your tissue.
Now, when you say the organ, you actually put the procedure is actually going to happen to the organ.
Yes, I am going to take these growth factors, these repair factors, and put them right into the male penis. Put them right back in there without hurting him.
Okay.
I numb him up with the cream. No pain. For the women, we put it right into the vaginal area, and the clitoris is much bigger than that little thing that we always try to rub on and stimulate.
Right.
So there's an area where I can put the medication right in there and get the clitoris to get more blood vessels, get the clitoris to get more nerve endings, and for it to swell a little bigger, okay, doing a few exercises to get a little larger so that it's easier to stimulate and there's more sensitivity. There's another thing we haven't talked about with women. Some women, after they've had babies, get bladder leakage. Like they get a little cough, sneeze, leak thing, and they have to wear these pads. Okay. And some of them get embarrassed. They're afraid that they might leak when they're having relations. And so they're hesitant to have relations because they might leak.
Okay. Now, explain the leak.
Okay. Well, think about your sink. Under your sink, you see that elbow.
Right.
Okay. One of the functions of that elbow is to keep the gases from coming out of the sewer back into the house. So we don't smell gases all through the house. But if you go into an old house where the toilets have been removed and they got some paper stuff down in it, they all had this kind of smell about them.
Right.
Right? This musty kind of smell. That's the gas that's coming out of the sewer. Okay.
Okay.
Put that elbow there, it holds everything back.
Holds everything back.
Well, we have that same kind of kink once the urethra comes off the bladder. And our big heads and our shoulders and our big butts, as we come down that vaginal canal on our moms, we loosen that tissue and we straighten it out a little bit, and they lose a little bit of that kink to the urethra.
Okay.
I put the kink back because it's that kink that holds the pressure back in the bladder. So if a woman tries to, like if you go to a Zumba class, all right, I shouldn't be telling women secrets here. I'm going to tell one of them.
Okay, tell me one.
So you go to a Zumba class, and you'll see some women at a certain point, they drop down to the floor, and they do some exercise near the floor, I guess dropping it like they're hot, like it's hot, they say. Okay. Some women can't drop because if they drop, it puts too much pressure on the bladder, and they'll leak a little urine. Okay.
Gotcha.
So you'll see them do something fancy standing up. Okay. Same thing. You'll see women. Some women won't do squats with the weights, or they, certain moves in the. They won't do jumping jacks. Okay. Or even in a dance class, you'll see them doing line dances. You see somebody jump. You'll see a lot of women stay real cool.
Right.
Down.
Right.
Yeah. Because if they jump,
and come back
they
down.
may squirt a little bit. Okay.
Oh.
And that's because the urethra has been stretched out.
Okay.
We put that kink back so that they can jump up and down, or they can have intercourse without worrying about a little pressure on the bladder causing them to leak a little bit.
I'm getting a great education today, Doc, on everything that your capabilities and your practice. Let's first talk about number one. We haven't even talked about this. Tell us your location. How can someone here in Atlanta, or someone that wants to come out of the state into Atlanta just to come to see you, how would they reach you?
Well, I am at Smartplex ATL. That's SMARTPLEX ATL. And ATL stands for Aesthetics, Treatments, and Lasers. Okay? But since we're in Atlanta, it also stands for ATL.
Right. Okay.
So Smartplex ATL.
That worked out fine.
For men, it's Smart Men's Center. They can go to Smart Men's Center. Okay. Or they can go to Smartplex ATL as well. And there's a section for men. There's also a section for women where we talk about these procedures. I am starting a blog. We had one, got away from it. We're getting ready to blog a lot now because people are telling me they need this information.
Well, definitely.
So we're gonna be blogging. I'm gonna do a lot more on Instagram, showing things. Actually, I think on my site, the O-shot is actually being demonstrated live with a young woman who's on the phone talking at the time that you won't see me because I won't show her private parts, but you'll hear me. And I'm between her legs doing the procedure, and she's on the phone.
Okay.
She's on the phone talking. Yeah.
Is that already posted?
Yeah, it's already posted.
Okay.
So you'll find her
Okay.
out there. So it's a very simple procedure. We have procedures that tighten the whole pelvic floor as well. We have procedures that tighten the vagina itself.
Okay.
So that the walls are tighter. Because some women, they say after they have had their babies, especially the second or third one, they say, hey, I can't feel my man like I used to. Okay?
Yeah.
And so we can tighten those walls back down without surgery. These are all non-surgical procedures so that feeling is there. That feeling is there. So not only can we help the male to get back into the game, but we make sure that the women are experiencing what they should be. Okay. And that, we're educating the men too, that there's certain things they need to do to make sure that their women are getting the fulfillment that they should be getting out of this. So they're going to be chasing you instead of you always chasing them.
Okay.
That's the ideal part. So yeah, we're in East Cobb.
Okay.
Very close to Sandy Springs. So we're in that area there. And Smartplex ATL, you can look at us online. The number to the office is 678-245-6777. So you go 678-2, it's 456-777. Okay, and you'll get us all day long. We have some great people waiting to talk to you. We do a lot for the body. Anything that's rejuvenation, getting people to feel young about themselves, look young, feel young. We do IVs that help with energy, that help with skin glow. that help with the immune system. We also have a number of modalities. We have an infrared sauna that helps to open up the blood vessels as well.
Okay.
It is absolutely awesome. People come in just for the sauna. They come in several days a week, and they fight over the times that they can get in there. It's that effective. It helps to detox you as well as open up your blood vessels. Will even decrease your blood pressure.
I like that part.
Yeah, we have that.
That's all part of the show.
And then we have, we do the hormonal replacement as well, because I think that's very, very important. We talk about nutrition because, just like we said, if there's plaque that's affecting the organs of men and women, that's not the only place it's being blocked up. It's being blocked up in other places. So when you come in for your procedure, I'm going to be harping on the fact. So understand, you walk into my office, I'm not just doing a procedure on you. Okay, this is not about just opening up those blood vessels. I want to do that to get you back into the game quickly. But if we're going to win at this thing, we have to have total health. So I'm going to get you exercising again. I'm going to talk to you about diet. I'm going to talk to you about detoxification. I'm going to talk to you about getting that plaque out of that area, not getting it back. We're going to put you on a maintenance program. Okay, so these are all things that we need to do in order for us to stay healthy, because anything that we do now, if you're 40, 50, 60, 70, anything you're doing now, you should be able to do when you're 90. And there are people in the United States who are still having sex, who are still exercising, who are still running, who are still working. There's a woman in Atlanta who's 93, 94. She's still volunteering. She works a 4, 5, 6 hour day, 3 days a week at one of the hospitals. Okay. My neighbor is 91, 92. He's still driving his car. He does 2,500 ab exercises a day, and legit ab exercises a day. Okay. He's fit. He walks in the morning. He goes to the gym. He does his ab exercises, does some light weights. He does his chest and everything right after or just before dinner in the afternoon. And he is 92, 93. If you see him walking down the street, you will think you are seeing a 40-year-old man. Yes.
Okay.
Yes. His body is just that tight. So no one wants to really age.
Right.
And if you adopt that thinking, you can determine yourself how you do it.
Okay.
You don't have to look your age. You don't have to feel your age. You do have to commit.
Okay. Understood.
Yes.
Well, Dr. Alex, I'm going to tell you something. I know I've got a great education today. I know the listeners have too. We're going to have to do this again because I know you have some more information that you want to put out. But we're going to take baby steps with this because I know they got a lot of great information. So we're going to do this again, sir. Thank you very much. And one more time, give them your phone number and the website one more time.
Okay, we are at Smartplex ATL. My name is Dr. Elmore Alexander. You'll find me online. Please go out there and look at all of our reviews. We're pretty proud of them, and we have a lot. So go look at our reviews, Facebook, Instagram. What's the other one?
Twitter? Are you on Twitter?
I think we have some Twitter out there too, as well. I don't man all of those sites. I have some people who do that for me. But I do answer questions as well. And we're at Smartplex ATL. The phone number is 678-245-6777. And the website is smartplexatl.com. Please give us a call. Check us out. We'd love to take care of you. We'd love to assist you in being your very best.
All right. Thank you, Doc. All right, y'all. Until next time, you've been on the Ledge VIP, and this is Carl Calendar. Okay, everyone, that's a wrap. Please make sure that you follow us, share, and download the episodes from iHeartRadio, Spreaker, and you can definitely, once again, follow us and listen to the show on YouTube, Google Play Podcast, and Castbox. Thank you, and we're out. On the Ledge VIP Podcast.